Venice, 1320. You are born in Venice, a merchant's son, third child. That matters. Your father trades spices from the east. He can read. He can calculate. He teaches you numbers before you're 7. This is rare. Most children work docks or looms. You sleep 4 to a room. Stone walls, cold. You eat twice daily when trade is good, once when it's not. Your mother dies when you're 9. Childbed fever. The midwife burned sage. It did nothing. You learn early. Death comes for reasons no one understands. At 12, you apprentice to a physician, not by choice. Your father arranged it. Cost him 40 ducats and a promise of future trade. Medieval physicians aren't surgeons. Surgeons are craftsmen, barbers with knives. Physicians study theory. Galen, Hippocrates, ancient texts from Greece and Rome, translated through Arabic. You memorize the 4 humors: blood, phlegm, yellow bile, black bile. Disease means imbalance. Treatment means restoring balance, bloodletting, purging, emetics. You learn uroscopy, examining urine color, smell, clarity. 21 distinct types, each supposedly reveals inner imbalance. You don't question it. Neither does anyone else. This is what the University of Padua teaches, what masters in Bologna know, what medical authority says. At 18, you read Avicenna's Canon in Latin, badly translated. You study astrology. Planetary movements affect health. Saturn governs the spleen. The moon governs the lungs. This is medicine. You never touch a patient, not yet. Theory comes first. Years of it. The Black Death arrives, 1348. You're 28 when ships arrive from Crimea. Black Sea ports, Kaffa, rats come off the boats. Nobody notices rats. Venice has thousands. Then people start dying. It begins in the poorest quarters. Castello, dock workers, prostitutes. People assume it's divine punishment for sin. They always assume that, but it spreads. Within weeks, it's in every parish, rich and poor. Pious and corrupt. Indiscriminate. The Venetian Republic panics. The Council of Ten needs physicians. Doctors are fleeing. Padua, Bologna, Verona, anywhere away from the coast. You're offered a contract, municipal physician, triple the normal salary, housing provided, protection guaranteed. You accept, not from courage, from debt. Your father's business collapsed. You need the money. They give you a hooded cloak, dark cloth, waxed against the damp, a scrap of cloth soaked in aromatic herbs pressed over your nose and mouth. The theory: disease spreads through poisoned air, miasma. Sweet smells counteract corruption. Some physicians carry a pomander of dried flowers and camphor at their belt. It doesn't work, but no one knows that yet. You look severe, austere, official. That's enough. People start giving you a wide berth. Your day begins at dawn. You visit 12 to 15 houses, sometimes 20. You enter through doors marked with crosses, red paint, warnings to stay away. Inside, bodies, living and dead. Sometimes you can't tell immediately which is which. You check for buboes, swellings in neck, armpits, groin, black, purple, leaking. If they're present, it's plague. Official diagnosis required for burial permits. You lance some buboes. Theory says releasing corrupt matter helps. It doesn't. It just spreads infection faster and causes agony. You prescribe Theriac, a paste of 64 ingredients including viper flesh and opium. Costs a fortune. Does nothing. You bleed patients. Reducing blood should reduce fever. Instead, it weakens them further. They die faster. You recommend fleeing the city if they can afford it. The rich already left. You write death certificates, hundreds of them. The city requires documentation. For what? Mass graves don't have headstones. Popular culture will later show plague physicians as sinister, mysterious figures. The reality is exhaustion. You work 14 hours daily, 7 days a week, for months. You watch people dissolve, not metaphorically, literally. Hemorrhagic forms of the sickness cause blood to pool under the skin. Bodies turn black, limbs rot while patients still breathe. Children die in 3 days, adults in 5. The strong last a week, suffering longer. Your treatments fail, every single one, because you don't know about Yersinia pestis, about fleas, about bacteria. These concepts don't exist yet. You're working with 1,300-year-old Greek theory applied to a disease that requires magnifying instruments you won't have for 4 centuries. You're not stupid, you're ignorant. There's a difference. The first wave ends. Half of Venice is dead, maybe more. Census records were never kept properly. No one counted, you survived. Not from skill, from luck. Probably limited exposure to infected fleas. Possibly prior resistance from a mild case, you'll never know. The Republic keeps you on. Permanent position. You're now a municipal doctor with a guaranteed salary of 150 ducats annually. Good money, very good. But plague returns. 1361, 1374, 1382, every 12 to 15 years. Each time you're summoned. Each time you put on the cloak. Between outbreaks, you treat regular patients, fevers, wounds, consumption, childbed fever, gout, stones. Your success rate is perhaps 20%. Most people either recover naturally or die regardless of intervention. You know this. You don't say it. You maintain authority through costume, ceremony, Latin phrases. Patients want confidence. You provide it. You're not a charlatan. You genuinely believe humoral theory. So does every physician in Europe. Believing wrong information isn't lying. You marry at 35, a widow. Her first husband died of plague. She needs security. You need someone to manage your household. You have 3 children. One dies in infancy, flux. You couldn't save your own son. You're 65. Your hands shake. Old fracture in your left wrist, poorly set. From a fall during the 1374 outbreak when you slipped on blood-slick stairs. Your eyes weaken. Reading is difficult. Uroscopy becomes guesswork. Your hearing fades. Patients repeat themselves. You pretend to understand. The Republic still employs you. Reputation matters more than ability at this point. You're a survivor. 4 major outbreaks. People trust survivors. But younger physicians arrive, trained in Padua's updated curriculum. They know techniques you don't. New translations, new theories, still wrong, but newer. Your salary continues. Venice respects seniority, but you're assigned fewer cases, easier cases, nobles who want an experienced name, not actual treatment. You spend more time reviewing documents, less time touching patients. Your wife dies in 1390, pneumonia, winter. You prescribe the same useless remedies you've prescribed for 40 years. You're tired, not dramatically, just tired. You die at 78, remarkably old for the period. Not plague, stroke. You collapse during a council consultation. Dead before you hit the floor, they give you a Christian burial. Church of San Zaccaria, modest monument. Your family pays. The inscription reads, Physician of Venice, servant in pestilence, faithful unto death. It doesn't mention that almost everything you did was medically useless, that your treatments killed as often as they helped, that you were trained in a system built on ancient errors. None of that matters to the stone carver. Your death certificate survives, filed in Venetian archives, 1 page among thousands. Your published case notes don't survive. Probably burned during a later plague outbreak when officials destroyed documents they believed to be contaminated. No portraits exist. Too expensive for a municipal physician. The image of the plague physician endures. Not yours specifically, but the silhouette, the beaked mask that later generations will design and attach to your kind. It becomes Venice's emblem of plague, of death. Popular culture will remember physicians like you as sinister, as choosing this work, as mysteriously effective. The evidence reveals you were a civil servant, following orders, doing your best with catastrophically wrong information. You saved almost no one. But you documented everything, and documentation, however flawed, gives later generations data. Even failed science contributes. He believed he was helping. His society believed it too. He was wrong. Systematically, completely, fatally wrong. But he showed up. Every outbreak, every dying house for 40 years. History preserved the mask, not the man wearing it, the terror, not the exhaustion, the image, not the reality. If you want to see another life the sources reveal, stay.